This lecture is on diabetes mellitus. Diabetes mellitus is actually a group of metabolic diseases characterized by hyperglycemia due to defects in insulin secretion, insulin action, or both. So it's not just one disease, it's actually a group of diseases. In dogs, diabetes mellitus is most commonly secondary to immune-mediated destruction of beta cells, and this leads to an insulin deficiency. However, in cats, diabetes typically results from tissue insulin resistance. Diabetes can also be secondary to pancreatitis or endocrine diseases such as hyperadrenocorticism or hyperthyroidism. Diabetes mellitus can be diagnosed in various different ways. The most reliable criteria for diagnosis is the presence of concurrent hyperglycemia, glucoseuria, and ketonuria. And this is because this combination of findings is not expected to occur with other diseases. Diabetes can also be diagnosed by documentation of persistent hyperglycemia with persistent glucoseuria. A single point diagnosis of diabetes is based on hyperglycemia with glucoseuria, but this is more difficult to diagnose since it can potentially be caused by a transient hyperglycemia, such as excitement. So, to help diagnose diabetes at a single point in time, you can look for other clinicopathologic changes that diabetes tends to cause, and these changes will be presented on the next slide. Or, if the associated changes are not present, then you can measure the serum fructosamine concentration. Fructosamine is glucose bound to protein, which is primarily albumin. When glucose binds to albumin, then it takes on the half-life of albumin, which is about 2 to 3 weeks. Therefore, an elevated level of fructosamine indicates that there was a persistent hyperglycemia that occurred over the past 2 to 3 weeks. So, this is a way of documenting persistent hyperglycemia retrospectively. The glucose tolerance test can also be performed, but this test is beyond the scope of this course. These are lists of associated clinicopathologic changes that may occur with diabetes mellitus. Glucoseuria and ketonuria can cause osmotic diuresis and subsequently a decreased urine-specific gravity and urine electrolyte loss. Glucose is an osmotically active particle, so it can draw water from the extravascular space into the intravascular space and therefore dilute the substances within the blood vessels. And this may result in dilution of sodium and chloride and therefore hyponatremia and hypochloremia. If there is excessive ketoacid production, then a titrational metabolic acidosis can occur. Insulin deficiency or insulin resistance results in mobilization of lipids, causing hypertriglyceridemia, hypercholesterolemia, and potentially hyperlipidemia, which results in lipemia. Proteinuria may be secondary to glomerular disease and a diabetic nephropathy. Mobilization of fats can lead to fats accumulating within hepatocytes, and this is called hepatic lipidosis. Hepatic lipidosis can lead to hepatic dysfunction and cholestasis. Persistent lipemia can activate pancreatic enzymes prematurely, so not in the intestine, but within the pancreas, and this can cause a secondary pancreatitis. And glucoseuria can cause secondary urinary tract infections. When animals are treated for diabetes, exogenous insulin is administered to move glucose from the blood into cells. However, it moves potassium and phosphorus into cells as well. So too much insulin can cause life-threatening hypokalemia or hypophosphatemia. Ketone bodies are produced by the liver from the breakdown of fatty acids that have been mobilized from adipose tissue. They are mobile forms of lipid energy that are primarily used by the muscle and kidney. Acetone is the spontaneous breakdown product of acetoacetate, and acetone cannot be used as energy. Instead, it's excreted by the lungs or the kidneys. Acetone is the substance that gives diabetics breath that smell like nail polish. Ketosis is an increased concentration of ketone bodies in blood, and ketosis is detected by positive urine dipstick reading for ketones. Ketosis occurs during times of a negative energy balance, which most commonly occurs with starvation, ketosis in ruminants, and diabetes mellitus. Ketoacidosis is when keto acid production is so severe that it results in an acidosis and an acidemia. Diabetic ketoacidosis is when ketoacidosis occurs secondary to diabetes mellitus.